Welcome back. That was Dr. Thomas Frieden, the head of the U.S. Centers for Disease Control and Prevention, talking about the transmission of Ebola to a healthcare worker in Texas. Joining us here in Washington is Alexandra Phelan. She's an adjunct professor in public health law and ethics at Georgetown University and is currently researching the key legal issues of infectious diseases in the face of such global health issues as pandemics and refugee mobility. Also with us in Washington is someone who's no stranger to dealing with the Ebola outbreak. Robin Sanders was the U.S. ambassador to the Republic of Congo during the spread of the virus in 2002, 2003, and witnessed much of the work that went into combating it then. She would later serve as the United States ambassador to Nigeria. Welcome to both of you to the show.
Thank you.
Ambassador, let me start with you. As I mentioned, Ebola is not new to Africa. You were in the Republic of Congo when there was an outbreak in 2002, 2003. How was it dealt with then?
Well, mostly dealt very well with looking at the source of origin. You have to remember that for Ebola, you have a source of origin, generally from a food source. And it was very much linked to cyclical food shortages when people were eating alternative protein sources. So I think that that's one of the things that needs to be looked at here. Where did the source begin in West Africa? Was it migration from Central Africa of bats or rats or bushmeat or what have you? But I think that's one of the things that needs to be really focused on. What was the original source? Additionally, isolation worked very well in that environment because you did really limit people's movement. You brought in civil aviation authorities early on so that you had some of the checks that we see now happening earlier. I think if they had happened earlier in this instance, we might be in a different situation. And the other area that they need to focus on is port entry. People are coming in through ports in the United States or they're coming in through ports in other countries. Are we doing the same kinds of checks that we have just started at airports at points of entry of ports as well? And I think that's a gap that needs to be looked at.
Right, Alexandra, we have the disease, which started in West Africa. It's traveled to other parts of the world right now. So is there an international plan, as I asked one of our previous guests, in place? And what do you think of that plan that could prevent the spread of the disease from it getting to other parts of the world?
So currently the World Health Organization is the international body responsible for dealing with outbreaks like this. And they have a particular piece of international law called the International Health Regulations, which were developed and introduced actually after SARS in 2003, when we realized that we didn't have any global responses that were effective to dealing with infectious disease threats. Now, as of February this year, there were only 22% of countries that had actually fully implemented the requirements for the IHR. So globally, we're quite underprepared for dealing with a global pandemic. And President Obama announced the Global Health Security Agenda, which aimed to provide funding and technical expertise for developing and low-income countries to put in place strategies for being able to detect, prevent and respond to disease threats. And what we've seen in this situation is that money isn't quick enough and it wasn't there early enough, but that's a global position. So the US was really taking the lead, but globally we need a lot more.
All right, Ambassador, talking about the challenges in dealing with Ebola, we look at the situation in 2002, 2003. How has the situation now changed? Because we've had, of course, populations are growing in that part of Africa. There's been greater urbanization, so there's more people concentrated in one part of the country. So, how great is the challenge right now?
I think the challenge is tremendous because you are seeing this outbreak in urban areas. Before in 2002, 2003, and even in 2004, which really didn't make the news, they were more in village areas that you could really control a little bit better. But once you get to an urban environment where people live and work very closely, it's very difficult to control. The other factor is what I call the human cultural factor that needs to be taken into account. There are very clear traditions on how people treat people who are ill, who are sick, who are family members. There are a lot of rituals and traditions that are involved in that involve really being involved with the body. And I think that's added to the spread of the disease. And I think we have to really reach out to community leaders, to religious leaders, and to elders in villages as well as in the urban areas that have a relationship with the community so they can really start to begin to have this better dialogue and communication on how people protect themselves and how they can help diminish the spread of the disease.
Right, Alexandra, in trying to combat the spread, I mean, we're hearing very mixed reactions. I mean, we heard our two previous guests say that screening should be carried out, but they should be carried out not at the point of entry or point of arrival, I should say. They should be carried out at the point of departure for people in West Africa. That's the one thing. The other is we have some world leaders, like the Foreign Minister of Australia, for example, who's now saying that health workers should not be sent into these areas. So very mixed reactions. There's talk of sanctions, talk of closing borders. There's a lot of misinformation here, isn't there?
Absolutely. The first point is that screening is occurring at point of departure in, for example, in Liberia, in West African countries. And the thing about screening, regardless of whether it is at point of departure or point of arrival, is that it is likely to be ineffective in majority of cases. The first point being that Ebola has a very long incubation period of up to 21 days. The screening can also pick up a range of other illnesses that cause a fever. So the flu, we're coming into the flu season here in North America. The Foreign Minister's response about Australian Foreign Minister refusing to send health workers is very disappointing, because what these countries in West Africa need right now are trained epidemiologists, doctors, nurses who have the training and the expertise to go help. Currently, there simply aren't enough health workers on the ground. Médecins Sans Frontières, or Doctors Without Borders, has been handling 2/3 of cases in West Africa. And that's a not-for-profit entity.
Okay. Ambassador, I just want to get back to something you said a moment ago, and that is cultural issues in West Africa. And that, the Anthony Fauci of the National Institutes of Health also mentioned that, for instance, when someone dies, the tradition is that the body is touched or kissed in a certain way and washed before burial. You can't do that anymore. So how does it complicate things?
Well, I think, fundamental to the public health issues that my colleague here just mentioned, I think that communication element has to be included in what we are all doing. I think that the Texas situation is a really good example of where the communication breakdown also can cause the transmission. You can't send someone a link to tell them what to do in terms of putting on their equipment and protective gear and all of that. Médecins Sans Frontières, Doctors Without Borders, worked very effectively in Congo when I was there, but they really know how to manage this process of disrobing and putting on the protective gear. And maybe what we need here is for teams of Doctors Without Borders to come to the U.S. to help our health workers, because it really is about practicing this technique so that you don't have this transmission. The cultural issues are really, really important, because I think you have to communicate to people through the cultural leaders that they respect, understand, and trust. And I think that trust factor is really a big issue that is getting left out of the communication element of this. And without that, without people trusting the person that's communicating to them, or trusting the person that's reaching out to them in a public health manner to help them, I think that you're going to have people very scared, hiding whether they're ill, trying to move from one location to another if they think they might be ill. And I think these are issues that we have to pay attention to.
Right, Alexandra, let's look at what we have right now, which is in place. We have screenings, which are taking place, as you point out, point of departure, point of arrival. There's a vaccine, which is being tried out right now. People who have already died are isolated and are being buried in that way. What else needs to be done?
So the vaccine is a potential vaccine. It's still in its very early stages of safety testing, first in the US and the UK, and now in Mali. And so we can be hopeful that it will show not only safety but efficacy. It'll actually work. So that's stage one. We've also got a treatment for people that already have Ebola. So there's been talk about ZMapp and other possible treatments that, again, have not yet been tested or not been proven to be efficacious and also safe. So there's got to be a lot more research there. That's key. The quarantine and isolation is an incredibly effective strategy with Ebola. So what needs to be done, though, is similar to what the ambassador was saying, is that needs to be carried out in a manner that is communicated to people so people can trust it, and is also culturally sensitive. So there were concerns, for example, with the quarantine in Dallas of the close contact family members of this man that passed away, that there wasn't adequate food provided or water or compensation for their job. So, and then there were armed guards at their door. So these are all issues that really need to be approached. So we need to know, how are we going to deal with quarantine and isolation when it occurs, and how can we implement it effectively? And when it is implemented, it can be very good at stopping the disease.
And that's where we have to leave it. Thanks to both of you for joining us.